Hey guys, here is a scaffold. I apologize, it's been a little bit later than you probably expected. It has been a crazy afternoon. So we've got here, you are rock climbing with a few of your friend's carabiner. Okay, the carabiner is just the thing that holds the person to the rope. Breaks and they tumble down the rock face approximately 10 meters. Their leg is bleeding profusely and the bone is protruding from the skin. So this is just a scenario that I have taken from your workbook. Let's go. These boxes here, okay, this is just a simple Word document and I have just inserted one table 5 times. These primary survey, secondary survey, correct diagnosis, informative management plan, and moral or legal implications. These are just the skills that we're assessing you on, but it is also a great guide to help you make sure you've covered everything that I'm looking for as I go through your assessment. So primary survey, doctors A, B, C, D. I apologise in advance. I have horrendous typing and it's probably not going to get any better at this time of the day. So bear with me and feel free to laugh along. So doctors A, B, C, D, okay. Danger, okay. Danger. Is there danger to you, okay, or your friend? Okay, these are the things I'm looking for in your scaffold. The scaffold is the whole idea to get you to plan, okay, to make your plan of attack. I'm not marking you on your scaffold. Your scaffold is not your final product, okay, but so you have an idea of how you're going to get from A to B, your scaffold is going to be your guide, okay. So primary survey is always doctors A, B, C, D, so let's relate it back to our scenario. Okay, is there any danger to them? Okay, depending on where I, for example, would film this, is there any danger to my friend? Okay, is there rocks falling? Oh, goodness me, those typing skills. Rocks falling. Are you near a cliff? Okay, these are all the things that you can be talking about. Again, I'm not a mind reader. Okay, you need to say these things in your actual assessment. Are they responsive? Okay, response. Okay, are they talking? Can you say hello? Okay, hello. Can you hear me? Okay, hear me. Oh, God, goodness me. Okay, so these are the things you need to be kind of putting down. Send for help. Okay, we've got 000. If you really want to get some brownie points, what's the other one? Think about it. Think about it. I'm assuming you said 112, okay, for your mobile. That's where you can send a message, okay? I'm saying that here because I'm rock climbing. Where am I? Who knows, okay? Who knows what location I'm in? So I'm going to cover all my bases in my response and make sure that I've told you that these are the options that I'm thinking about. Airway, okay? Is there anything obstructing their airway, okay? Obstructions. Okay, this is a simple case in your scenario of having a look and saying, oh, is your airway clear? Good, great, fantastic, we're moving on. Okay, it doesn't have to be a 10-hour assessment of their airway. Are they breathing? Okay, what type of breathing is it? If they're breathing, okay, if they're responding, they're breathing. What type of breathing? Okay, they've gone through a pretty traumatic experience here, okay, so they could be having short, sharp breaths, okay. You might need to reassure them through their breathing. Comment on it. Okay, mate, I can see that you're in pain here. Okay, let's try and focus on your breathing. Try and breathe through the pain if you need to. Let's slow your breathing down so we can try and reduce the risk of you hyperventilating. Something like that, okay. Okay, compressions, CPR. Do we need to do it? No, okay, at the moment, no, okay, and defib, okay, if I'm not doing CPR, I'm probably not doing defib, so at the moment, no, okay. You've covered your primary survey. Secondary survey, also known as your head to toe, okay, if they've fallen, oh, look at that, no capital, if they've fallen from 10 meters, okay, 10-meter drop, okay, could equal internal injuries, okay, bleeding, okay, there could be other hidden fractures. All right, these are the things I need to hear you talking about. I don't expect you to have someone who's helping you out with your assessment to exhibit all of these signs, but maybe you can just show me that you're looking for them. Oh, you've fallen from 10 meters. I'm just going to do a quick head to toe, blah, 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 blah. Okay, that's what I need you to be looking at. Secondary survey also, okay, my up here it tells me that my bone is protruding from the skin, but part of my secondary survey is to observe, okay, if there are any fractures. Observe. Are you getting annoyed at my typing yet? I am. Fractures, okay. This kind of is going to tie into your correct diagnosis here. Kill two birds with one stone when you're doing about it. The skin's, okay, skin's popping out of the skin. The bone is popping out of the skin. So what does that mean? What type of fracture is that? 3, 2, 1. It's an open fracture, okay? The skin is protruding. It's an open wound. You're going to reassure them, okay? They're probably freaking out a little bit by now. Reassure them and send for help or seek help. Okay, this is your starting point. Correct diagnosis. Okay, so this is it's not an overly complicated one, but there is something, there's your protruding bone, okay, and you're bleeding profusely. Profusely means a lot, so there's a lot of blood going on. You've fallen 10 meters, you've got a bone sticking out of your skin, you're losing a lot of blood. Something that's not in that scenario, if you're thinking very first aidy, is we could maybe come across shock. Okay, so correct diagnosis, we've got an open fracture. Okay, oh goodness me, an open fracture. We have profuse bleeding. We have potential for shock. Okay, I'm not telling you he has shock. I'm not telling you that it says it in the scenario, but as a first aider, you need to also kind of preempt these things potentially. When you've got your correct diagnosis, okay, it's going to affect how you treat this injury. Okay, so your informative management plan, what are you going to do? This is pretty much, this is the crux of it. What are you going to do? Okay, this is where I'm really looking to see your skills. This stuff is all important, but sometimes this can probably be done in quite a short period of time. Okay, you've come across, you've seen your friend falling over, they've got a bone sticking out of your leg. You're looking, is there danger? Are they responsive? All that kind of stuff. This doesn't mean you have to break it down and be like, danger, blah, 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 blah. Response, blah, 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 blah. Okay, but the one thing you will need to really break down for me and show like quite extensively is your management plan. What are you going to do? Okay, and because you've diagnosed, okay, you're now going to have to assess which injury you will treat first. What will you treat first? Shock? Well, shock, okay, we haven't got it yet. We're preempting shock, so that's kind of the last of our worries at the moment. We've got bleeding and we've got an open fracture, okay? What did Muhammad say yesterday when we did first aid? What should be your priority? Okay, your prioritize. Yes, I spell things out as I type. Your priority at the moment should be the bleeding. Okay, so number one is the bleeding. What are you going to do? What are you going to do to stop this bleeding? Okay, if I was you, I would be looking to apply compression, okay, or pressure in an attempt to minimize the bleeding. If it doesn't stop, what can we do? Okay, we can maybe apply another bandage over the top. If we don't have a bandage, okay, what can we use? I want you to show me these things. If no bandage available, what could you use? Okay, shirt, okay, just any clothing in general that could act to prevent this loss of blood. If possible, if there's bleeding anywhere else, okay, are we able to elevate anywhere? Okay, These are the things I want you to talk about. Next, I'm just going to do a quick squizzy to see how much time I've got, because this only has a certain okay, I've got 5 minutes before my time runs out. Okay, now you're going to look after the fracture. Okay, what are you going to do with this fracture? You're going to try and to immobilize it. Immobilize fracture. Again, unless you have a little donut bandage, unless you have bandages there, how are you going to use this? Or how are you going to do it, sorry. Do it with the resources. Oh my goodness, team, this is abysmal. With the resources you have, okay? Have you got a shirt? Have you got clothing? Are you organized enough to actually have a first aid kit? Which you probably really should if you're going hiking with your friend or kayaking. What are we doing? Rock climbing. Goodness me. Okay. That's quite a brief one, but it's still giving you an idea of what you need to be doing. Okay? Down here, moral or legal obligations. So notice this word or. Okay? Some of your scenarios happen in a workplace. Therefore, there are different obligations or implications that you need to look out for. This one, we're two friends, okay, we've gone rock climbing and an accident has occurred. I have moral obligations, okay, because I'm there with them. So the moral obligation would be to help a friend, okay, who is severely hurt. Okay, you were there at the accident, the scene of the accident. Okay, that is your moral obligation. And you specifically now, if we're talking about you, as in you, Left Eddie, Irene, okay, Jane or Namasha, okay, you, oh, Namasha's not quite, that's all good for me. You are a trained first aider. Okay, your moral obligation has just stepped it up a notch. Your legal obligation, okay, I want you to think about it. There is one. I'm going to give you 3, 2, 1. Okay, have you asked for consent? Okay, have you asked for consent? All right, that's how you tick off that box. Oh my God, you've fallen, you're so hurt. Do you mind if I do some first aid on you to try and help you out? Your patient is going to go, yes, please help me, okay? And then you can go from there. So guys, that's a rough one, okay? I could pass this to somebody else and they could go, okay, Carly, that's great, but, okay, what about here? What if they do go to shock? How are you going to treat that? Why don't you put that in your scaffold just in case, okay? How, Carly, are you going to immobilize your fracture? Maybe you haven't put any elevation in here, impossible, okay? It's the leg. Can we elevate the, oh, it doesn't say that, but you, okay, it does, sorry, their leg, okay? Why aren't we trying to elevate the leg, Carly? This is something you need to be adding in here. Okay, this is what I want from you when you do a scaffold. This is a brief one, okay? I understand you have other things to do, but please have something similar to this to bring into class on Monday. I will see all your lovely faces tomorrow. Have a great night.